At times I don't do too much, and then I get out of breath,
Right.
Even sleeping at night, I have to move around.
To get comfortable.
Yeah.
Because you get a little breathless when you're laid down.
Mm-hmm.
Okay.
But other than that, I don't do anything, So.
Right. But so the problems that you were having with that carvedilol.
Oh yeah.
You're not having any of that.
Well, I haven't taken that for how long?
Right. No, I know. But so you those issues have not been a problem, I assume.
No.
So you're taking the losartan, the 25 milligrams,
And Spiro.
spironolactone, 25 milligrams, and that neither of those medicines are causing you any problems.
Well, she's complaining about being weak and
Very
tired.
Weak, tired, and I can't sleep. I mean, I'm up out of one bed, go down the stairs to the living room and sleep for a little bit, and come up to another bed, and I'm very restless where I don't.
Right.
sleep.
And but is it breathing that makes it hard to sleep?
Probably more anxiety, I think.
Okay, but you don't have a lot of energy and you're weak and you get out of breath quickly. Right, so these are all symptoms of your heart failure that in theory the medication could make better. So the medicine isn't the cause of the problem, the disease is the cause of the problem. The MRI shows that your ejection fraction, Mrs. Hinesley, was 21%. So remember, normal is like 50 to 60. So your heart is working about a third of normal on the squeezing. And as far as the valve, there's a significant amount of leaking, probably proportional to the amount of weakness and the increase in the size of your heart. As the heart gets bigger, weaker and bigger, it can create more leaking. So
What did they say at the heart center?
that's what I'm talking about.
Okay.
This is that heart center test that
Well, and I've had 2 UTIs, and then I had a yeast infection also.
Right. So I think that we need to do. I think we need to consider. I assume since he's increased your glimepiride, that your sugar's not been too low.
No.
No.
Right. So I think we should go back on the low dose of the Jardiance.
Okay.
Not because of your sugar, but to help with your heart.
So should I be on glipizide also then?
Yes.
Okay.
And then this losartan that you're on the lowest dose of, I want to nudge that up a little bit from 25 to 50 milligrams. And then I want to have you see our people in Indianapolis that are advanced heart failure specialists, so they can go over these results and talk to you about what else they might be able to do with your medicine. It's possible that they could also consider a special kind of pacemaker to help your heart to work better. But I think we need to get you, you're just, these symptoms, you're not getting better.
No,
fast
not really.
enough. Yeah.
There's some days that I do pretty good,
Right, but there's a lot of days that you don't. And you're not being able to tolerate some of the, you couldn't take Entresto, for one, and carvedilol for another. So I want to get you in touch with these experts in heart failure, see what they think.
Okay. Now we were at the ER Monday evening, and
yeah, they put me on Lasix.
her BNP was 2,600.
And they put you on daily Lasix?
I've only had 3 pills. I got 1 pill left.
Yeah, I think what we're gonna wanna do, Mrs. Hinesley, is probably continue that Lasix beyond 3 days
Okay.
to help keep the fluid out of your lungs and with your breathing.
Good.
Everybody says you have to pee, and I haven't had to do that. I mean, it's still sort of dribbling, at times.
Okay.
Since they put her on that, though, she's been a lot better the past 3 days.
Couple days.
Yeah.
I don't doubt it. Okay, so we're gonna slightly bump up the losartan because her blood pressure is a little higher than we would like it to be, and it'll help the heart. That's the most important reason. The other we're going to restart the Jardiance at just 10 milligrams a day for the time being, and I'll send Dr. Estep a letter about why we want to keep her on that. And we're going to continue the Lasix. The other medicine, the spironolactone, that stays the same. And I'm going to see if I can get her hooked up with these advanced heart failure folks in Indy
Okay.
to go over all
I
that.
hope soon, so we can get something done,
Yeah.
I've been since February, March,
It's
and
been a
April.
couple months. Yeah,
Yeah.
3 months, coming up on 3 months. Right.
Yeah.
Okay, all right, thanks, Mrs. Hinesley. Any other questions or anything for the peanut gallery on the phone?
I don't know how much Jardiance I've still got.
I can get that renewed, I can refill that.
That's mostly for heart, not for the.
It's entirely, in her case, for her heart.
Okay. Okay.
It's,
Okay.
any bonus effect it has on her sugar is just extra credit. But yeah, it's a heart medicine for her.
Okay.
That's what I want to try
I
to
know
make sure
somebody
Dr.
said
Estep-
something about Carciva or something like that. Farciva.
Farxiga,
Uh-huh.
same thing as, same
My mouth.
same principle, guys, as Jardiance.
Okay.
Also approved for both diabetes and heart failure, effective for both.
Okay. Because our
This Farxiga,
niece is a drug rep down in Florida, and
she can get her
can get her
Farxiga.
Farxiga, yeah.
I got no problem using Farxiga instead, if that's something that would be easier for you guys to get a hold of.
I know about insurance and stuff, even with.
Well, I think it'd be samples probably or whatever.
Yeah.
Okay.
All right, so I'll make it Farxiga if that's what you guys want
Instead
instead of Jardiance.
okay.
Okay.
So.
Whatever you think.
No, to me it's
You're the expert here.
yes.
So.
Well,
So where do,
as far as that class of drugs, it's probably 6 of one, half dozen of the other.
Okay.
but it wouldn't help any going in and doing something to the valve.
Well, that's one of the questions that those people were going to ask, but based on the MRI, my gut feeling is probably not. That valve leaks, so it's a little bit of a chicken or egg question. And so you raise an interesting question, which is challenging to answer. There's been a couple different studies that looked at trying to repair that valve leak with special catheters. They clip the valve essentially so it doesn't leak as much. A European study didn't show any benefit. A study in the United States did. When they tried to figure out, like, hey, we're using the same stuff, and they look like, why the different outcomes? What they basically felt like was the United States patients, their degree of leaking was more than you would expect from the size of their heart and the weakness. Whereas in the European study, the degree of leaking was the amount of leaking was probably due to the size of their heart and the weakness. So what they're basically, so the question was, is your leaking out of proportion to your weakness? If your leaking is out of proportion to your weakness and heart size, it probably is beneficial to cut down on the leaking, because the leaking is probably contributing to the problem. But if your leaking is proportional to your weakness and heart size, then it's probably not going to make things any different if you decrease it, because the fundamental problem is still the weakness. So, and that's how so I'm interested in what they think about that. Based on your numbers from the MRI and the report, my guess is they're going to lean away from fixing it, but that's what I don't know. I want their thoughts on that.
Yeah, would this be at the heart center again or what?
Yeah.
Well, and also I've noticed too, if I bend over,
Right.
sometimes I get a
Get
little.
winded. Yep.
So it's more of a heart weakness than a problem, than a leaky valve problem.
Yeah. So what basically, if you can imagine like this, imagine this doorway is the valve. So it opens up, lets blood in, we close the heart squeezes, this room's the pumping chamber, it squeezes, the valve closes. The valve closed tight, No leaking. Okay. Now the heart gets weak and starts to enlarge. The door jamb gets bigger. The valve no longer fits. The door no longer tightly fits in the door jamb because everything about the room has gotten bigger except the door. The door's the valve. Now when the door closes, it doesn't close tight. It leaks. So that's a problem where you got to shrink the room. Fixing the valve doesn't really help. Does that
makes total sense.
kind of make some sense?
Yeah.
Okay, so wait here, and we're gonna tweak these medicines like we talked about. We'll go with Farxiga. We're gonna bump up the losartan. We're gonna order some blood work after the change in medicines, and we're gonna try to get you hooked up with the heart failure jocks
Quickly.
Thank you.
as quickly as we can. Yeah.